Hi, I'm Gavin Routledge, Clinic Director and Osteopath at ActiveX Clinics. So you're in pain and you'd like to know, should you move or should you rest? Many years ago, 20 years or so, when I first started in practice, it was commonly prescribed for people in pain that they should rest, particularly by the orthodox medical profession. However, this wasn't based on any firm evidence, and around that time a lot of research was done into particularly lower back pain, acute low back pain, and the benefits of rest versus exercise. Nowadays, the answer is wholeheartedly move. If, when you're in pain, you simply rest and wait for the pain to go away, even if the pain does diminish, the chances are that you're much more at risk of the problem from recurring again. So the simple principle I always use, and the little phrase we like to use, is use it or lose it, but don't abuse it. And the don't abuse it bit is important. If you do things that cause you significant pain, it may take a little bit longer to get better. But on the other hand, that probably still leaves you with lots of things that you can do movement-wise that don't cause you pain. So use it or lose it. It's a simple physiological fact. If you don't use your muscles and joints, they will get stiffer, there's less blood flow, so things take longer to heal. So it's very important to maintain as much mobility as you can that doesn't cause you any pain. So, to recap, if you're in pain, regardless of whether it's back pain, neck, shoulder pain, strained your ankle joint, the principle is use it or lose it, but don't abuse it. And that applies to the advice on exercises that I or others may give you. If you're doing an exercise and it hurts, then just back off a little bit. It doesn't mean that you shouldn't do it at all, but just don't do it to that extent. Okay? So, now this advice I've given you is particularly appropriate for relatively recent onset problems, pains that you've maybe only had for 6 weeks or less. Anything particularly over 3 months, the advice does vary slightly, and we'll be doing a video clip on how to manage chronic long-lasting pain at a later date. So for pains that are particularly 6 weeks or less, apply this principle, use it or lose it, but don't abuse it. Okay, you can find out more information on how we can help at www.active-x.co.uk. Okay, bye-bye.